Hi, podcasters. Welcome back to Skin the Surface. On today's episode, we will discuss a procedure that helps add volume and fullness to the skin, and that is filler. But how much filler is too much? And how do you make sure that your filler looks natural? We will get into all of that today. As we age, our skin gradually loses volume and with gravity begins to sag. Fillers can help restore back that volume to the skin and can actually be used in a variety of locations, including the face, lips, and even the top of our hands. We can also use filler in the treatment of acne scars. Some expert dermatologists have even begun to use filler in other areas to stimulate skin tightening, and we will get into why shortly.
So as Rina mentioned, filler is a product that's used to add volume to the skin, but it's not one size fits all. There are numerous different kinds of filler, and the factors that distinguish them are based on particle size, ease of handle, and how much lift they provide. The majority of fillers that are used are temporary or semi-permanent, and that basically just means that eventually the body's going to break them down. But more often, they actually stimulate your own skin to increase the amount of collagen over time.
Yeah, that's actually a concern I get all the time from my patients, especially those who are new to fillers. They often worry that the results will be permanent. The filler molecule that we most often use is hyaluronic acid. This is actually a natural substance made by our own bodies, and so it's not actually a foreign substance that we're injecting into our skin. This hyaluronic acid lasts about 6 to 8 months, and in addition to volumizing the skin, it stimulates the skin to increase collagen production, as Mary mentioned. Another concern I often get is that will they look overdone or overfilled? Products that are placed strategically and purposely in certain areas in the face can appear very natural. A line that I commonly use that one of our mentors, Dr. Nazneen Sadie, taught us is that one syringe is typically less than a teaspoon.
Yeah, that's a great visual. So Rina, how would you know what type of filler is right to use?
Well, that is why it's so important, Mary, to seek care from a dermatologist who is skilled in not only understanding the skin, but which products to use and where. So like you mentioned, filler is not a one size fits all, and there is an art as well as a science. And that is why we pick certain fillers to treat certain areas in the skin.
Yeah, that's so important to mention, Rina. Not all injectors are made equal. And remember, undergoing a cosmetic procedure is not just about your appearance and convenience. It's also about your health and safety first. Now, you're ready to get filler. What should you expect? Before getting the injections, we'll often numb the skin in the area that's being treated for about 15 to 20 minutes, and that helps with any discomfort from the procedure itself, although we've got many seasoned vets who don't need any numbing at all. The area of the face is then cleaned to avoid any excess oils, makeup, or debris, and then we inject the product. After filler injection, you may experience some swelling, bruising, and a little mild discomfort, and this can really be improved with icing the area over the next day or so. Unlike Botox, most of the time you're going to see the results instantaneously. And for acne scar treatment, these results are a little bit more gradual, and you're going to notice them over weeks to months as the body slowly starts to make more collagen to fill in these deep depressed scars. However, it is important to note that there are some more serious, although less common side effects that you may want to know about before you get treated. So Rita, can you go into some of these?
Sure. Understanding the anatomy of the face is super important when injecting filler. We have numerous blood vessels in our face, and we definitely don't want to inject any filler in the blood vessels because, as you can imagine, this can have serious consequences. This is better shown in a picture, and we will link an image to this, to the blood vessels of the face on our website. And as you will see, this is why it's very important that your injector is adequately trained, ideally board certified, and experienced in injecting filling products. Well, that's all we have for today. Our next episode, we're going to discuss a topic that many of our listeners and friends have been requesting, and that is how to get rid of stubborn hormonal acne and back acne. And also, don't forget to continue to check out our website, skinthesurfacepod.com, for additional updates, blog posts, and new exciting developments.